Visitors to the U.S. comparing medical insurance often ask, what is the difference between fixed and comprehensive coverage? Insurers typically explain the difference between fixed and comprehensive coverage by showing a comparison table. As a general rule, fixed coverage premiums cost less. Comprehensive coverage offers potentially higher benefits. Fixed coverage allows you to select any provider. Comprehensive coverage uses negotiated rates. Then there are other important comparisons with India network plans, where both fixed and comprehensive coverage is comparable, including major medical direct billing from the provider to the insurance company and pre-existing condition coverage. So why can it be so difficult to understand? The reason is simple. There are trade-offs when selecting one plan over the other. So what is the best way to compare plan types? India Network suggests a series of questions to help determine the best plan for your situation and recommends Easy Select from the Instant Quote button on the India Network home page. Let's walk through the key questions and explain why each is important in determining the best plan. First, what is the age of the family member or members? While generally speaking, fixed coverage has the lowest cost premium, for some age groups, comprehensive coverage can offer the highest potential coverage for only pennies a day more in premium. For seniors 70 and older, comprehensive coverage can be very expensive and would be selected by those where monthly premium is not an important consideration. Rather, the primary concern is the maximum benefit. The second key question: is a visiting family member currently taking medication for high blood pressure, diabetes, or other health issue? If the answer is yes, and specifically the concern is that the condition might result in an emergency, as a general rule, pre-existing condition coverage should be selected with the plan. Importantly, India Network offers pre-existing condition coverage for all age groups, with both fixed and comprehensive plans. For age group 60 and under, if having the highest pre-existing benefit is the most critical issue, India Network fixed coverage plans offer the highest in the industry, up to $60,000. The third key question: how long will the family member be visiting or working in the host country? If the family member is visiting for less than 1 month, fixed coverage is likely the best choice. Comprehensive coverage has a minimum 30-day initial enrollment requirement that would make it an impractical choice. If a family member is staying 3 or more months and they have a pre-existing condition, they meet the minimum 90-day initial enrollment requirement for the pre-existing condition coverage that is available with both fixed and comprehensive plans. For those wanting to extend a visit or manage the premium payment, all India Network fixed and comprehensive plans can be renewed online in just minutes from 1 to 360 days. The fourth key question: are you most concerned about an expensive accident or emergency and capping your out-of-pocket expenses? Comprehensive coverage caps medical expenses for new issues at 2 levels per incident: a standard deductible of $250 and a coinsurance of $1,000. The $1,000 is calculated based on 20% of the first $5,000 of in-network policy-defined medical expenses. After these levels are met, 100% of the policy-defined medical expenses are covered up to the plan maximum. Fixed coverage insurance is defined by a per-incident schedule of benefits, and plans offer a range of new issue deductibles from as low as $75. A network provider is not required, and coinsurance is not required. As a general rule, comprehensive coverage offers higher benefits for major medical issues, while fixed coverage plans are available that may result in less out-of-pocket for minor accidents and emergencies. The fifth key question: is a network provider with a negotiated rate the preferred method of selecting your plan? Comprehensive coverage offers a negotiated rate with providers in the multi-plan network. Negotiated rates can be reassuring to those wanting to manage the costs associated with major medical expenses. To facilitate the pre- and post-enrollment process in comprehensive coverage, India Network offers a multi-plan provider search from the India Network website. If a provider is not available nearby, In-network rates may apply for the provider you choose. As a general rule, fixed coverage may have higher charges than negotiated rates. Importantly, with fixed coverage, the insured can choose any provider and can have the provider directly bill major medical expenses to the insurance company. India Network wants to simplify the process for selecting a plan. Use Easy Select from the home page of India Network Health Insurance. Look for the Instant Quote button. Choose the appropriate link for the age group, either with pre-existing conditions or without pre-existing conditions. Then take time to read through the choices, especially look at the best deal, most popular, and the best tip. Compare premiums, deductibles, and coverage to maximize your benefits. Thank you for taking time to better understand how to compare fixed and comprehensive coverage when selecting the best plan for your family member visiting the USA. To learn more, go to indiannetworkhealth.com or call 877-204-0222 to speak with an agent.